Flat feet is one of those problems that most healthcare providers just don't know what to do about, except offer stretches and insoles for your shoes. Most people just learn to live with flat feet and avoid doing things that cause pain. In this video, I'm going to answer the question, can flat feet really be cured? And I'll also explain everything you need to know about treating your flat feet. I'll also explain everything you need to know to begin to fix your flat feet. Let's answer the question, what are flat feet? Well, there's two types of flat feet. The first is a functional flat foot. That's the most common type. And then the second is a structural flat foot. Now there's more divisions in that depending on your age and other factors, but just for the purposes of this video, you need to be aware of a structural flat foot and a functional flat foot. Flat feet are also known as fallen arches. So just in case you're confusing the two terms, it's the exact same thing. Now this is a functional flat foot right here, and you can see there's an arch right there. In a structural flat foot, it looks like there's always a flat foot. Even when your foot's in the air like this, it stays flat. In a functional flat foot like this one, the arch does come up when you take pressure off the foot, but when you put pressure onto the foot, the arch then goes down, it collapses. Now the bones in the foot right here that create the arch need to be flexible so that your foot can interact with the ground. But then when you're going to press off your foot to move on to the next thing, then those bones need to lock together in place and create an arch. And that's from the muscles that come in here and help to flex the toes. They help to lock in the arch of the foot right here to create a little bit of an arch. So if you have a fallen arch or a flat foot, your foot does that, and it's a functional flat foot, then that means that the muscles in the area are weak and they're not able to create an arch for you. Are flat feet genetic? Absolutely yes. If your mom or dad had this, or if your grandparents have had flat feet, then it's likely that you're going to get the same genes from them, the same type of feet. And so your foot's ability to maintain an arch might be affected if they had the same problem too. Now, if you had a structural flat foot that runs in the family, then that's a different situation. Remember, the information in this video is not going to directly apply to you. That's a whole different situation. Are flat feet painful? Having flat feet can directly cause pain in your feet and ankles, but most of the time it doesn't cause pain right away. It tends to cause pain higher up in the knees, the hips, and even into the lower back. This is why you sometimes hear healthcare professionals recommend to their patients with knee, hip, and back problems to get new shoes, because usually the cushion in their shoes that have been helping to support the arch has worn out. If you've had the shoes for 6 months or more, that's the guideline with that. Then getting new shoes restores a little bit of an arch support from your shoe onto your foot, and so it better aligns your knees, hips, and reduces the compressive forces going through your lower back. And although it's less common to have foot and ankle pain directly from a flat foot, it does happen. We see it here in the clinic all the time, and most of the time it's very fixable as long as it hasn't been there for too long and there aren't any arthritic changes that are more permanent. Now, what are the common treatments for flat feet? Well, the first thing that people often do is put ice and heat on their foot just to get some short-term relief. It's very common for healthcare professionals to recommend to patients to freeze a water bottle in your freezer, of course, and then roll over it after it's frozen, because you can kind of massage and put cold onto your foot at the same time. People often get pain relief if they're having pain directly in their foot from that. If it's bad enough, some people will take over-the-counter pain medications. And if you end up going to the doctor because the pain is bad enough and not able to be treated well with the over-the-counter medications, your doctor might recommend prescription medications that you can take by mouth. And if that doesn't help, they can do cortisone pain injections into your foot to get some more localized relief, some relief directly in the arch of the foot or wherever you're having your pain in your foot and ankle. Of course, all of these options are just short-term pain relievers. They're not fixing the root of the problem, but that might be what's necessary for you in order to get up and do normal daily things. Now, some people will also find relief from over-the-counter arch supports, or they'll get custom-made arch supports. When I'm talking about arch supports, I'm talking about what you would put on the inside of a shoe. This is my favorite brand of shoes called Olukai. They sent me this pair of shoes. I'm so excited about it. And I like this brand specifically because they have an insole that it comes with that has a natural arch support right here. And so it's rigid. It's not super soft. It has some give to it, but it just gives you that nice little support. And you could buy these over the counter too. You can buy them at your drugstores, at most big shopping stores like a Walmart, a CVS, grocery stores that have a pharmacy section will typically have something like this. And you can replace the insole that's in your shoe with something like this, or if you go to a specialist like a foot doctor or an orthotist, somebody who makes these custom, they'll mold your foot and build you a custom one depending on what your foot needs. Now, there's a lot of debate on whether a over-the-counter one like this one is better or worse than a custom built one, and the research is showing that they're about the same. In my personal experience, I found that if you have a structural foot problem, you should probably go get some custom orthotics made, which is going to cost more money, of course, but you don't have as much of an ability to create an arch, because if you do have a functional flat foot, then there's things you could do to modify it. And an over-the-counter support like this one might be enough to get you by while you're getting stronger and fixing your own flat foot. Now, other treatments are to be sent to physical therapy to do stretches and exercises. They may or may not recommend something like this as well. And in extreme cases, surgery is an option for flat feet. There's three most common procedures that are done for flat feet. The first one being a foot reconstruction surgery. And in this procedure, they'll transfer tendons, possibly cut bone in your foot to recreate an arch. Usually they're putting in metal screws and plates to do this. Then a foot joint fusion or an arthrodesis is something that's also done, and that's where they lock the joints into position, usually with plates and screws, in order to not allow that arch to collapse at all. And another surgical option is a wedge osteotomy, where they're cutting a wedge-shaped space, a gap in the bone of your foot, and then they're using metal plates and screws to kind of hold it open and then filling it with bone from somewhere else in your body. They have to go harvest that so that they can shape the bone a little bit different. But this helps to keep the joint mobility in your foot so that you can better use your foot. Now, these surgical procedures are going to be absolutely right for certain people in specific situations, but you have to take into consideration that it's usually a compromise or a trade-off. If you're going to go have a surgery for a foot problem, a flat foot problem, then you're going to be losing some muscle function, especially if they reposition a tendon. You might change the shape of a bone in your foot. You might lose the joint motion in your foot as well. And losing those things have long-term implications for you. You might permanently not be able to use your foot the right way. And although it may give you some pain relief, it may not allow you to do other things that you want to be able to do, like walk as long as you want, be on your feet for as long as you want, or even do more extreme activities that you particularly enjoy, like hiking or running. Doing any sort of resistance exercise where you're putting weight on your feet is always a concern, because it's in the back of people's heads of, is my plate in my foot going to support that? Am I going to mess up the screws in my foot? Am I going to undo the surgery and have to go back in for another surgery? So I strongly encourage you to treat the root of the problem naturally first before resorting to surgery, having that conversation with the surgery, because they're likely going to tell you the surgical options and push you towards surgery if you're a good candidate for it. And sometimes I think they overstretch a bit what's possible, because they don't always see, that the surgeons don't always see the possibility of improving naturally, because that's just not their specialty. Now I'm going to talk about the root of the problem and how to fix flat feet naturally in just a moment. But first, let's talk about what happens if you don't fix your flat feet. Well, directly in the foot and ankle, you can run into arthritis, bunion problems, bone spur problems, plantar fasciitis, tendinitis, and bursitis in your feet and ankles can consistently happen in your feet, especially if you just do a little too much, a little bit more than what your muscles, joints, and bones in your feet and ankles can tolerate. That's what sets off some sort of itis somewhere in your foot. And when I say itis, I mean inflammation. It could be bursitis, that just means inflammation of the bursa, tendinitis, inflammation of the tendon. Arthritis is inflammation of the joints. And if your arch remains fallen, it's going to affect the knee, because the knee is going to want to collapse inward. So that messes up the knee joint mechanics, which leads to arthritis problems in the knee in the long term. In the short term, it's possible to get meniscus injuries, knee bursitis, knee tendinitis. You can also get ligament problems like MCL tears, ACL tears, and you can also damage the cartilage behind the kneecap more so as a result of having a fallen arch. One more joint up higher in the hip, when that ankle falls down because the arch is fallen, it sets up the hip to be in a different position than it's supposed to be in the ball and socket joint. So that increases the possibility of developing hip arthritis, hip labrum tears, bursitis, and tendinitis in the hip. And if your hip and knee aren't moving well, then it's only going to cause problems even further up into the low back. You can get back arthritis, stenosis problems, herniated disc problems in the back as well. Now let's get straight on what a cure means, because if you mean by cure that you never ever have a flat foot again, then there's only one solution, and that's surgical fixation of your arch. But we already talked about the trade-off that comes with that. You might lose muscle function, tendon function, the joints might be locked. You're not going to operate normally in your foot. You're not going to have a normal foot again. Now visually, your arch might be there. It may look better, but you can't get back to walking as long as you want. Hiking, exercising, running, doing any of those things are going to be very questionable moving forward if you have a surgery like that. So yeah, your arch was cured, but what did you lose? But if you take a cure to instead mean healing naturally by getting the right muscle stronger, using certain things like maybe an orthotic, an insole to assist you, and getting to the point to where you can walk as long as you want, you can run as much as you would like, you can hike, you're not really limited in any activities, but you have to maintain your strength. There may be a few things that you do or things that you modify in order to be able to sustain doing things as long as you want. That to me is definitely more of a cure, because if you can preserve the way that your foot is supposed to work, even though it's not a perfect arch or it doesn't look ideal, but you feel great and you can do what you want, I would prefer that situation personally, and all the patients I've talked to are usually on the same page with me. The main thing to remember is that you've got to maintain strength in certain foot muscles for the long term in order to have no problems from flat feet. In other words, it's a maintenance thing. You have to continue to exercise. Just like teeth. You don't brush your teeth once and never expect to have a cavity again. You have to brush your teeth every day, multiple times a day, floss. There's consistent maintenance that you need to keep up in order to keep your teeth healthy for the long term. In the case of flat feet, functional flat feet, the number one problem is that the toe curling muscles, the muscles that help you to curl your toes, are too weak. And it's those muscles that help you to generate an arch. If you just take off your shoe right now and curl your toes, your arch begins to climb up if you have a functional flat foot. And then there's another muscle called the posterior tibialis muscle, and there's certain ways to exercise that muscle too. If you can up the strength in those muscle groups and maintain it for the long term and use it in your everyday activities, you should be very healthy moving forward. Hey, I hope this video was helpful for you. Give it a thumbs up if you thought it was. Don't forget to subscribe and hit that notification bell so that you don't miss out on any of our helpful videos that we post each and every week. Please share this with somebody you think needs to hear this as well. I'll see you in the next video. Bye-bye.